In this presentation, you'll gain lots of great insights from Dr. Robert DeMaria and Dr. Griffin Cole, two great healthcare providers. First up, Dr. Robert DeMaria will reveal a disturbing reason why irregular heartbeat issues are on the rise and a simple way to avoid serious health consequences. You'll also discover several reasons why blood pressure can increase to dangerous levels, plus a very special message for women over 50 concerned about heart health, including the #1 food to eat on a regular basis. Enjoy this presentation with Dr. Robert DeMaria. So, Dr. Bob, I've studied stroke volume, QRS-T wave, you name it. Lots of stuff about heart function. But I'm sure I'm going to learn a bunch from you today. And I know a lot of healthcare providers and just the regular folks out there. They're going to get a lot as well. So let's get to it.
So we're going to be talking about heart function today and how everything you do actually does, Jonathan, impact the heart. Many people don't even realize that the heart is located in the center of your chest cavity. It's covered by lungs. So the heart's a pump, and it pumps supposedly 72 beats per minute. But what we're seeing in our practice today is that individuals are having hearts that are racing. They're going faster, and they're having anxiety, and their heart's pounding, and they're coming into the office, and they're saying, Dr. Bob, I have this heart palpitation, and I don't know what's going on. They want to put me on drugs, and I just don't want to do that. Can you help me? So let's backtrack a little bit. The heart, like every other organ in the body, has what we call innervation, nerve innervation. That means that your brain sends messages down to the upper part of your back, and a part of those nerves go to your heart. So in our practice, I practice clinically as a chiropractor. I also have a Doctor of Natural Health degree, and I really taught human dissection when I was in college. So I've learned a lot about the heart. The nerves from the upper back impact heart function. So we're starting to see now, because of screen time, poor posture, people's heads are going forward, impacting those nerve segments that go directly to the heart. But back in the 1980s, I was having individuals come into my office, and they just loved Dr. Bob on Tuesday, Wednesday, Thursday, and Friday. They just loved the care that we gave them. But we started having people come in on Monday saying, hey, what did you do to me last week? My neck is killing me. So I started to do a little bit of research. Embryologically, your pancreas starts in the upper back, and it moves here to the middle of the chest. The pancreas innervation is very close to the heart innervation. So what I've seen over time, people who like to eat sugar, that's not any of you, is it? People who like to eat sugar places a demand on their pancreas, and the pancreas will literally send messages back up to those segments, and I can show you on an x-ray it causes misalignment. Those are the same vertebrae that overflow to the nerves to your heart. I've been practicing since 1978, have nearly touched 1 million people in that time period. And I want you to know that we have had less than 6 people in our practice have heart attacks. Why? Because we make sure that that part of their spine of the nervous system is functioning on a regular basis. But if we slow this down a little bit, your heart is a pump, and it sends blood through your whole body. So the blood oxygenated goes out, and then it's going to return. But when it returns, it comes up through this organ right here, which is the liver. If you look on the bottom part of the liver, this is a vein. This is always a test question on the national boards. This is the inferior vena cava. Don't ever ask me where they come up with these names, but this is the inferior vena cava, and it goes up through the liver, and guess what it goes to? It goes to the bottom of the heart. So the blood's returning from your body through the liver to the heart. So that means if your liver is congested or compromised, it can impair heart function, something else about the heart I want you to know. The blood returns to a part of the heart called the right atrium. So people always ask me, Dr. Bob, what is the best way to sleep? Should I sleep on my back? Should I sleep on my stomach? Should I sleep on my right side? Should I sleep on my left side? So this is what I have learned over time. When you lay on your right side with appropriate pillows, not too big, not too small, the blood will flow smoothly and gently back into your right atrium. If you sleep on the opposite side, the blood can come back in too fast, could create some distress. I want to skip to another spot that's so important. It's blood pressure. Because I know a lot of you right now are taking blood pressure medications. Actually, the average Medicare patient's taking up to 5 different medications every day. So let me talk to you about blood pressure. This is a blood pressure cuff, and we use this in our practice. We take our blood pressure for our practice members or our patients when they are a new patient, but we also do something very interesting. We take their blood pressure sitting, and then we take it standing up. And the reason that we do that, we're checking for adrenal gland health. So your heart has to push that blood from the ventricles to the whole body. The top number is called the systolic number. That's the amount of pressure that has to push the blood through the whole body. And then the blood coming back up through the liver to the heart is the diastolic pressure. So ideally perfect, you want your blood pressure to be about 120. That's the amount that's going to go out to the whole body. I have seen that elevated for several reasons. Number one, for every pound that you are overweight, it adds 200 miles of extra blood vessels. Now you can get your calculator out and you can run the numbers, but I know a lot of you right now have a few hundred miles of extra blood vessels that your body probably doesn't need. So imagine this, your heart is pushing so hard and it gets tired. And over time, you might go see your well-meaning healthcare provider, and what he's going to do, he's going to give you a medication to trick your heart to pump different, but really you may consider losing some weight. But I know right now, some of you have stress. Actually, most of you have a lot of stress. The stress impacts your adrenal glands. You probably have heard of a term, beta blocker. So your adrenal glands have adrenaline. So if I yelled fire right now, you'd run out of whatever room or wherever you're at and anywhere in the world, and you would run quickly. But your adrenal glands secreted adrenaline for that to happen. Otherwise, you'd be stuck in a burning building. Well, all day long, I'm sure that most of you are hearing fire, 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 fire. And your adrenal glands are saying, I'm going to work hard, but after a time, the adrenal glands get tired. That's why we take our blood pressure sitting down. Because if an individual has high blood pressure over time, their heart's going to get tired, and so will their adrenal glands. So what we sometimes support and suggest is you might have to change some of your responsibilities. I'm going to give you permission right now. If somebody's asking you to do something like make 13 dozen cookies with pink frosting on top and sprinkles, here's what I want you to say. That the next time that somebody asks you to do something that you really don't want to do, you can say this: I can't say yes. You say, what did you say, Dr. Bob? I just said I can't say yes. That means you're politely saying no. So I'm giving you, right now, I'm knighting you, giving you the authority that you can back off all of the requisitions that people are asking for you to do something that's causing you to have this constant fire, fire, fire. Now, naturally, what we have seen in our practice, especially ladies that are 50 years old and older, they'll come into the office and they'll have heart palps. They're just going pump, 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 pump. The first 50 years of their life, their heart is doing good, they feel good, everything. And all of a sudden, right about the change, you know what I'm saying, ladies, right now, right about that time, you start to feel a little anxiety, you're not feeling good, you might be a little constipated, heart palpitations, and like, what is going on in my life? This is what we have seen. A lot of you need magnesium. Now, there's all types of magnesiums out there. We may use and suggest magnesium orotate. We may use magnesium chloride. But I am the firm believer of food being medicine. So you know what kind of food I eat every day? Green food. Do you know what's in green food? Chlorophyll. Chlorophyll has magnesium in it. So you should be pooping every day, twice a day. If you're not pooping every day, that means possibly you might not have enough magnesium in your body. So we encourage our patients, especially our female patients, that they might need and consider increasing their green food. Now, in all of our studies, we also know that water is very important for heart function because you don't want too thick of blood because that does impact how your body's going to function optimally over time. We also encourage our patients, whether it be male or female, to utilize vitamin D and having your vitamin D tested. Because see, vitamin D helps your body absorb calcium. So vitamin D helps your body pull calcium in from your intestine, it puts it in the blood, and it circulates it to all the tissues. Calcium helps calm blood vessels down so you don't have high blood pressure potential. So the heart itself needs to have specific nutrients to work optimally, and magnesium is probably one that most people don't think about. So let's switch gears just a little bit, and I want to talk about fast food and sodium. Because the issue, when you hear about salt, we don't tell our patients not to eat salt. We encourage them to use a salt like Celtic sea salt or Himalayan salt, a natural salt that's not been tampered with. You don't want chemicals added to your salt. But your body needs minerals for your heart to function at an optimal level. That was a lot of information, wouldn't you say there, Jonathan?
Yeah, no, it's just interesting what you're saying, that I would point out that you're talking about three things I'm getting from what you've said so far. You're talking about like spinal misalignment
That's correct.
affecting the heart.
Yes.
That's awesome already. Like, go see a chiropractor, make sure everything is, there's no impingements.
Yes.
You talk about toxicity. When you talk about if that liver is not working well, how that's affecting your heart. And then you're talking about, this is like the trifecta, nutritional deficiencies. So you've already told people in just 10 minutes or so, these three areas to really look at that'll really help your heart function. It's great. So with this trifecta that I'm talking about, why don't we just break it down just a little bit more to make it clear? Let's go back up to the misalignments in the spine. You were saying upper, but can you be a little bit more specific?
Well, you know, it's really quite fascinating when it comes to the individuals that come into our practice. Because of spinal films, so we take films of our patients when they come in. So we will look at their diet sheet. So let's say somebody comes in and they're having some heart issue, whatever that might be. Anxiety might be causing it, heart interruptions, not enough energy. So we look at their diet, and if we see a consistent basis of them eating sweets or any food that would compromise pancreas function, including dairy products, yogurt and ice cream. Any sweet fruits can do it also, like watermelon and strawberries and pineapple. And I'm not telling people not to eat those foods, but we see it places a demand on the pancreas. So when I started discovering this back in the 1980s, Jonathan, the vertebra in the upper part of the spine, the alignment is usually straight. But let's say that someone worked in a factory and they had a drill press and they were doing this, because back in the day, when I was first in practice in the 70s, there were drill presses. They didn't have automatic and everything was robotic. So you would think if someone was working at a drill press, all the vertebrae would shift to the handy side. So all of them would shift to the right side. But what's going on is that these individuals were coming into the office, and on the x-ray, the top vertebra in the upper back, which we'll call the thoracic spine, let's say it was shifting to the right. And then the one below it was shifting to the left. And the one below that was shifting to the right. And the one below that was. So because of my degree in spinal engineering, It's called, this is a very big word, a pathobiomechanical misalignment. In other words, that misalignment in their heart or in their upper back was affecting heart function. I've had more than one patient come into our office that were in AFib. They didn't even tell me that they were in AFib, or they were wearing a monitor, and after their spinal correction, it stopped. And they were like out of their skin because they may have been scheduled to have a pacemaker put in. So I want you to think of this nervous system function in the natural level as having a pacemaker in your body without all the surgery and all the wires and all the batteries.
And so when someone gets this adjustment, give kind of like a helicopter view. Is it that they're doing this every single week for the rest of their life? Do they have to do it more at the beginning and then kind of incorporate certain exercises to maintain structure? How do you talk to people about that?
Well, a part of what's going on today is we are, and it's really impacting so many parts of our lives, we have too much screen time. And with our screen time, our heads are going forward. And with our heads going forward, we're getting a lock in the upper part of that lower cervical and upper thoracic spine. So this is a trick question for everybody right now, and it's a pretty simple answer, and I know that most of you will get it. Does gravity ever take a vacation? Jonathan, gravity is continually and relentlessly pushing down on top of us. So most of the patients that come into our office, now in our practice, we take spinal x-rays in a lateral position, we take extension and flexion views. We're looking for that locking aspect, and we help improve that with non-osseous, more of an advanced type of spinal correction that it doesn't cause any discomfort in a person's spine. But a lot of times we'll see individuals have pain in their neck because they've been eating sugar, which aggravates the pancreas, and it causes this inflammation that's going on inside of the body. So bringing that back to the heart, the nervous system not only controls and impacts heart function, it impacts the function of every part of the body.
You know, you're making me think, Dr. Bob, when I feel super stressed out and I've got that inner tension, you know what I go towards a lot of times, just to, even if it's for a few minutes, lay on a hard floor. It's so interesting to me. It always blows my mind. Lay on the hard floor, get a little prop up with my neck, you know, something under my head, take some deep breaths, and I can literally like feel that tension sort of melt a little bit. Every now and then I'll take a deep breath and I actually feel like some of the bones will adjust a little bit. And I'm like, oh, I'm so glad that happens. You know what I mean?
Well, I can add something to you. Go to your local hardware store and get a paint roller and put that paint roller underneath your neck. And if you have any steps in your home, just let that head hang over the top of the step. And as it goes backwards like that, 5 or 6 minutes, it's miraculous what it will do to your body. I really want to go back to the liver aspect because this is an area that a lot of people truly don't have a understanding. So we take digital standing films of individuals' spine. I'm going to put an underline under the word standing because when you're standing, your liver has to be supported. But if you have a larger liver, and we are seeing, I don't want to use the word epidemic, but we're seeing a lot of people come today that your liver, look up here, your liver should stop right here at the last rib. But when you make unwise choices by consuming maybe too much alcohol, too much sugar, too many prescribed or over-the-counter medications, maybe taking some recreational drugs or processed food, your liver is responsible to clear it. Well, after a while, if you continue doing that, I have seen livers, Jonathan, this is no exaggeration, go all the way down into a person's pelvis. Now I'm going to really shift gears here a little bit because this liver has to go somewhere. We have seen people have chronic low back pain even after surgery because their liver was large and their pelvis kept on shifting. And ladies, I want you to know, usually your liver will enlarge extremely after baby number 2. So if you've had 2 children, you'd be very wise to find a local skilled chiropractor that takes digital films, that's very advanced, very minimal exposure, standing up. You can say, why do I want to do that, Dr. Bob? Because you want to see the position of your liver. But the good news is we have seen livers shrink 4, 5, 6 inches. And this is kind of interesting because see, the gallbladder is located right here. And when someone, because I know someone's had their gallbladder out because you're wondering, hey, what happens if you have your gallbladder out? Well, there's little clips right here. I want you to know I have seen gallbladder clips literally move all the way up because the gallbladder clips are in the liver. So as the liver is shrinking, I had someone just celebrate in our office last week. They were more excited about their liver gallbladder shrinking than they were about their pain going away.
And you reminded me of some of the first things I learned in natural medicine decades ago, where they would encourage everybody in the room to just take their fingers, right? You were saying where it should properly be, behind the rib cage, underneath, so it's protected. And they would say, just if you can get half your hand in there, I'm just thinking how many people would go try to just this very safe test, right? But how painful would it be for so many? That's got to be an indication something's going on, right?
Well, a lot of people try to put it in there and they think, wow, I can't do it. That's because your liver is enlarged. So some of the body signals for an enlarged liver or a liver that's not functioning optimally: varicose veins, spider veins, hemorrhoids, little red dots on your body called cherry hemangiomas. Ladies, you may have tender breasts with your menstrual cycle, heavy menstrual flow. So you can see how the liver itself is such an integral part of heart function. And then, adding the green food with the magnesium, because I see a large number of ladies that are over 50 years old that have been absolutely normal the first 50 years of their life. And then hormonal changes come in, adult responsibilities, aging parents, their own children having children, jobs, the whole aging process. So I'm going to encourage all of you, you want to eat green food every day of your life, because that green food is going to supply your body magnesium. Now, some of you might need to take some additional magnesium, and there's a couple different blood tests that we do. One of them is a liver enzyme called GTTP, and we have seen that you could have a normal serum magnesium, but the GTTP is an enzyme that's impacted by low thyroid function and also low magnesium.
Just wrapping it up really simply put, what you're describing here, painting this picture between the liver and how it affects the heart, you're really talking about, we hear this phrase, live an anti-inflammatory lifestyle, but it's not just a cliche. I mean, you're literally describing this on a functional level. The more inflamed we are, the liver level, throughout the whole body, now that spills over into our ability to absorb nutrients. You say, eat greens, take magnesium, get good natural calcium in. But if the person is running around inflamed and not dealing with maybe toxicity issues that are making them so toxic, making the liver so inflamed, all the rest of their cells inflamed, it's a real problem.
Well, it's a beyond real problem, because almost everybody that I see when I travel around today, you should look at your wrists and you should be able to feel the bones underneath your skin. And if you don't do that, we know that somebody's having an inflammatory challenge.
And so as we wrap up just another couple minutes or so, what other kind of foods are really good? I mean, I know I've mentioned in the past on many of my programs, sea vegetables and things like this, medicinal mushrooms, anything to kind of keep a fire down inside. What would you say?
Well, I can tell you that we encourage Dr. Bob's ABCs. That's a half a red apple every day, because an apple will actually help thin the bile in your liver. And the apple has malic acid in it, has wonderful fiber in it, but it's tremendous for keeping that bile in your liver flowing freely. And then beets. Beet fiber has been shown through research that it can lower your cholesterol up to 40%. Now, cholesterol itself is a whole nother story on how it impacts the function of the body. But beet fiber, I actually eat beets every day of my life. Most of the time they're baked with olive oil and balsamic vinegar with some Celtic sea salt. And then I eat a medium carrot every day, an organic medium carrot, because the carrots have a precursor for vitamin A, carotene, and the liver is the storehouse for fat-soluble vitamins, A, D, E, and K. That's the whole purpose of also with the greens. And I want to add one other item, and that happens to be the radish, which is a root. And I know from my experience that radishes will place a demand on your liver gallbladder mechanism. And by doing that, we know that it's helping to clear toxins in the liver. So if any of you have any digestive distress, when you eat a radish, it's not the radish. Your liver gallbladder mechanism has been compromised. So I really like to focus on non-starchy green vegetables, especially anything green that's going to help your body. As we said this like for the 14th time, magnesium is so important and so commonly deficient today.
I don't think you could say anything that you said today, Dr. Bob, enough. And I'm speaking specifically to all those healthcare providers out there that are still stuck in the Stone Ages. I mean, it's blowing my mind when I listen to you talk about the simplicity of looking at the gut, looking at the health of the liver, look at the health of your spine, on and on and on. And yet when someone presents heart problems, let's get a blood pressure medicine. Let's get cholesterol. Let's get a blood thinner. Let's put a device into the chest. And so most people out there are never hearing this information. And that's why I so appreciate you being here.
Thank you so much. And I know that it's really a simple puzzle. It's food and function, food, form, and function. All of them are all interrelated with each other. And if you're not feeling 100%, you want to find someone that's skilled and thinks a little bit different, getting to the root cause. You might want to go back and listen to this again, jot down some of the questions, and present that to the healthcare provider to see if they'd be able to give you an answer.
For some people, just another final thing I'm thinking about, who just want to make it really simple for themselves right away at the beginning, maybe knock down this inflammation, lose some weight. Any quick tips? I mean, people hear about water fasting, juice feasting, on and on and on. What are some things you might tell them as they leave here?
Well, I think everybody has, people come into our office, they always seem to have a day or two that they like to deviate from their diet. So I'm going to encourage you, try to go 2 or 3 weeks without deviating, whether it be ice cream, chocolate, any type of sweets that's going to, see, once you start eating sweets, your blood sugar is going to go up and then it's going to go down. And you're going to start this never-ending loop. I want you to know that people who drink alcohol have a harder time losing weight because they get hungry and their liver gets compromised. You really want to focus on low-calorie food. Make sure you're exercising on a regular basis. I have found that bicycle riding is probably one of the best ways to move and burn a lot of calories in the shortest amount of time.
Dr. Bob, I've said it before and I'll say it again. I really appreciate you coming out and spending time with me on this. Really important information. Thanks a lot.
Thank you for having me.
Next up is Dr. Griffin Cole, past president of the International Academy of Oral Medicine and Toxicology and one of the finest biological dentists in the world. Dr. Cole will clearly outline the most significant reason why your gum health is directly linked to the health of your arteries and why you'll never hear this from conventional cardiology. You'll also find out about the best at-home remedies to minimize the risk of heart infections. And finally, don't miss the single most important technique available to reverse gum disease. This one method alone can help to save millions of lives, and it's easier than you think. Dr. Cole, am I crazy? I'm checking with you. Gum disease. How underrated is this situation? Talk to me.
Extremely. 47% of adults 30 to 65 have some form of gum disease. The Hispanic population is actually 67%. People 65 and older, 71%. have some form of gum disease. This is very, very prevalent. It's a big problem.
You know, when I looked up, conventionally speaking, all about cardiovascular health, they'll tell you, you know, don't eat a lot of fat, make sure you exercise, this will reduce your risk of plaque. Plaque is the reason for heart disease. But then it's very interesting. There's literally, everything I just said to you is all they say in most of the search engines. You pick out any of these, Mayo Clinic, whatever. It's about a paragraph or two. Then there's even a smaller section, page 1, of all of these conventional sites where they say heart infections. Wow, that's interesting. Let's look at this. What could this possibly mean? And you know I'm being a little facetious here. But they look and they read, and all they say is, well, the heart infections come from, you ready for this? I hope you're sitting. Bacteria, viruses, parasites. And then, you know, you want more. And nothing else is said. And then they move on to something else about eat a healthy diet, plant-based, blah, blah, blah. The whole page is basically nothing for people. The connection, just address it. There is this connection, I want people to know, between gum disease and your heart, your cardiovascular health, right?
Well, I can say after 28 years in practice, I am now convinced it's the connection. I always knew there was some connection, right? But listen, they've done autopsies on these arteries to see exactly, and even on live people when they've cleaned them out to see culture, what's in there. They're predominantly oral bacteria, Jonathan. I mean, predominantly. It's not even a contest. So how's that happening? How is oral bacteria getting into the heart arteries? Well, we've already talked about that, right? It gets in our bloodstream and it gets down there. So if you've got gum disease, just by definition, you've got a higher number of the anaerobes that are causing this problem, right? They've shown that on a patient that bleeds easily, when you just lightly probe, they bleed, there is a higher number just by that process of bacteria that cause the harm to the heart arteries in their mouth right now. Okay, when they looked at all the species and cultured them all, Fusobacterium nucleatum, which comes from the mouth, it's the most dominant bacteria in our entire mouth. At 500 species, it's the most dominant. That was in high numbers. And the other one was Streptococci, right? All the streptococcal species, again, they come from the mouth.
All right, I want to speak directly, though, to those conventional cardiologists with all due respect. They've been trained, they mean well, and they say, well, I understand. Even the scientists out there, they just heard what you said, and I can hear the voices out there. And it's being told, in my humble opinion, to too many people. Everything you said is nice, Dr. Cole. It's correlation, it's not cause. But I just want to extend this for another minute or two. My take, and then I want to hear what you say. The idea that gum disease is there, and it's not respected enough. I think of Rodney Dangerfield. Hey, it's getting no respect. And the idea that when this infection is brewing and spilling into the body, people need to understand that this is a specific reason why your arteries are getting injured. And although conventionally speaking, hey man, plaque is the reason why you have your heart disease. There's plaque there. In many of the other presentations I've done here for the Cardiovascular Health DocuClass, we're talking about these buggies causing the inflammation, infecting your plumbing, if you will. The injuries are happening day after day, month after month, year after year, that then plaque is coming in to sort of protect and to help compensate in a very stressed out area. People really need to understand that this is cause. If you take away those buggies, your take.
Well, listen, what is Western medicine mostly about? It's about symptoms, right? What's your symptom? You've got this problem, here's a pill to fix it. And that's what statin drugs are. You could argue statins do some effective work. They do. But at what cost? And are you solving the functional problem, right? Functional medicine is all about, let's get to the source. The source is your mouth, right? Your bacterial count. What's going on? Are you acid? Is your diet poor? You got too much sugar? What is it? So if we can get to that and fix that, then all the rest of this is moot. It doesn't matter. You don't need pills at that point, right? And by the way, they've shown this too in studies. Even if someone's already got their arteries filled with plaque, but they changed and they do the things that we're discussing right now, diet changes, right, home care changes, those plaques will actually decrease in size. The lumen will get larger. So we can actually correct this, even in the middle of the process, just by changing our oral habits.
And it's interesting for those who are new out there, I want them to hear this. It's so important to appreciate the real intimate connection between pollution in the mouth, contamination that is spilling into the gut, because so many people do readily recognize, oh geez, leaky gut's not good. But the gut houses our immune system and all these inflammatory markers that most people do actually recognize, I think, more easily. Oh geez, these inflammatory markers aren't good for my heart and my cardiovascular system. But again, it's backward engineering going upstream, if you will, as another analogy as to why are the inflammatory markers going up? What caused your leaky gut, which then creates this autoimmune stress and all of these things on and on? It all started here in your mouth. Your mouth is the beginning of your digestive system, right?
That's exactly right. That's exactly right. This is where we see our skeleton. This is where everything starts, right? And it's the oral bacteria again. The oral bacteria in high numbers get into the rest of the body. This is what's causing the inflammation to where the markers now start showing up. But we don't look at that, right? I mean, we do as a biologic dentist, but I mean, most doctors and certainly most MDs wouldn't look at that at all. They probably wouldn't even ask, show me your mouth. Open your mouth. What's your mouth like? Are you seeing a dentist? Do you have gum disease? Those questions will probably never come up. And it's unfortunate because we could probably save a lot of time and take away some money from the pharmaceutical companies in the process.
And no doubt people should know that a lot of the quote-unquote advanced clinics of the world where people do have serious health problems, heart, especially even cancer concerns, their mind, their eyes, their attention, their conscience is not focused on, oh, it's your stomach that has a disease or your kidneys that have a disease. They actually clean up issues in the mouth first before they go into other fancy therapies or any other kind of conversation with people, right?
That's correct. That's how Paracelsus started. That's how there's probably 3 or 4 now all around the world that do that. The mouth is the first thing. Good point.
All right, so let's talk now. We're going to talk about things you do for people that have gum disease in your office at the end. But why don't we first talk about the things that people can practically do at home, which, you know, in my mind, Dr. Cole, it's not even that expensive. So let's talk about some of these at-home remedies that people should get started doing right away.
Okay, that's perfect. So let's talk about that. So first of all, we've already said just good home care, but what does that mean? Simple brushing and flossing. Okay, you don't need to buy the fancy toothbrushes that are electric or spin or whatever, ultrasonic. If you've got good dexterity, just use a manual brush, soft bristles. I don't care what dentifrice you use, just don't use mainstream like Crest or Colgate or any tartar controls because they're very abrasive and they got a lot of ingredients you don't want. Warm saltwater gargles. Salt water is antibacterial. It sucks the water out of bacteria. Simple, right? We can all do warm saltwater gargles. There's some good germicidals that are more natural. Essential oils like eucalyptus. Coconut oil is a really good one for oil pulling, which I'll talk about in a second. Tea tree oil, another good one. So these are oils you can get. You can order them online or you can get them at your local store or whatever. Great to put in the mouth as well.
I personally use clove and peppermint and neem. These are some of these blends, these oils that I put right on my brush and then boom, apply it to the outside and the inside of my teeth and just make sure I get every tooth. It's that simple.
It's that simple. And I love that you mentioned neem because you're exactly right. That was used way back with the Native Americans is how they did clean their teeth. So there's lots of toothpaste that have neem oil as well. So that's a very good point. You can also use white oak bark powder. It's high in tannins and it's really good for the gum attachment. It makes it tighter. Omega-3s. Actually, omega-3 fatty acids make your gums tighten. Now, I don't know if that's a collagen effect or what's going on, but it does work. You can see it happen. There is a product called ItSab. I don't know if you've heard of that or not. Its main ingredient is prickly ash bark, and it's very anti-infective. Now, there's some other ingredients like some iodine and some calcium chloride, but the main ingredient is that prickly ash bark. Again, very anti-infective. Most of those oils are very anti-infective, very germicidal. These are things we can all get a hold of. There's another product called Septolin, which is a multi-herbal mixture of guggul, guduchi, and licorice. Very anti-infective. These are just some things that you can get. So these are all products that we can get at home. And if you don't want to go buy anything, again, warm saltwater gargles, simple. Baking soda on the brush with water is very non-abrasive. It's nice, and it's a great dentifrice. Cleans the teeth well. What is it, maybe 50 cents a box? Lasts you forever. So these are things you can all do at home.
Let me jump in for a second and ask you, I know I'm probably splitting a hair, but a lot of people might be wondering, can you just use regular table salt? Is it sea salt? Does that matter at all? And also when it comes to the oil pulling, which a lot of people have heard about, maybe you want to talk about that as well.
Okay, I don't think I would use salt to brush just because of the abrasive nature of it. You know, having warm salt water is a nice thing to gargle with and swish around, but I don't know if I'd brush with, or even sea salt for that matter.
No, but that's what I meant about the rinsing. Does it matter if it's regular salt or sea
Oh,
salt?
I'm sorry. Yeah, no, it doesn't matter. I mean, just the salt itself is going to, you know, it's hypertonic solution, right? So it's going to make the water suck out of the bacteria. Oil pulling, Ayurvedic medicine. So oil pulling is unique in that it sort of came into favor just a few years ago, I guess. Most people started with sesame. Now coconut is the more preferred one. But what it does, if people don't realize what it does, is it actually pulls strep mutans, which again is the bacteria that causes cavities. It strips it off the enamel.
Yeah, there was a dentist who I once spoke to, I won't say the name, but just to balance this out for everybody, I want to get your take on this because I know you have a lot of years of experience. He was saying you could actually overdo oil pulling. You've got to be very careful. And at this point, I had already done so many programs and saw some value, and it can whiten your teeth and it keep your mouth clean. But just walk through like what would be reasonable.
Okay, so let's talk about that because that's really good because too much of a good thing, and I'll touch on that. So oil pulling, they used to say 20 minutes, right? You don't need to do that. Honestly, 5 to 10 is enough. And I tell patients don't do it every day. I don't think you need to. It's almost like when someone buys those ultrasonic, you know, those brushes, it's like your hygienist is cleaning your teeth every day. It's too much. So I agree on that. On that note, you know, there's a lot of toothpaste out there that have the charcoal, right? And they're all excited. And I love charcoal too. What I don't like are these pastes that have charcoal, bentonite clay, tea tree oil. There's too many stripping agents. It's too much. You don't want to take away all the good stuff as well, right? We get the basic biofilm off our mouth daily, and that's all you need to do. So don't overkill on some of these charcoal toothpaste out there.
Oh, that's interesting. You just reminded me of something else that I do on a personal level, but now I feel like I'm getting a personal consultation from you. And I have this stick with a little rubber tip on it, and I always check myself. It's interesting. Some days when it's a little bit maybe more sugar in my diet, even I'm talking about eating an apple, I notice the white when I take that rubber gum tip and I go along the gum line and I just sort of clean up. Man, I put that on tissue, toilet paper, right, just to see. I'm like, whoa, there's a lot of white stuff coming off versus other days where it's maybe a cleaner, less carbohydrate-rich day. And I go to do that, and it's way less. I find that very interesting. Maybe you want to talk about the value of what I'm saying?
That's incredible what you're doing. That's a great little test to see. And by the way, think about what's happening systemically if you're seeing that orally, right? They've even done studies where they looked at somebody who maybe eats oatmeal first thing in the morning. They test their blood sugar, and it's skyrocketing high. Somebody eats eggs, it's perfect, right? Everything's good. That's the whole protein and sugar argument. But your point is really good. That's a nice mark, a nice way to test to see, am I building more biofilm?
I've noticed also in connection with too much sugar, and I better be careful and not forget this moment in my life and do it again the next day. And the next day is that my tongue will be a little bit more white or, wow, nice and pink. And it's right away, that day. This isn't some ambiguous thing. It's very vague and it's hard to figure out. One day I'm a little off, a little bit more with some sweet or something, even if it's organic, it doesn't matter, a cake, a cookie, whatever. Boom, the white is around the gum, the tongue is a little white. Knock that out, 2 days, really clean and good. Tongue is nice and pink. Go with the rubber tip, and I'm barely getting anything at all. It is so dynamic.
The book Sugar Blues, written 30, 40 years ago by the Dufties, still holds true today. It's really simple, isn't it? Sugar.
So in terms of talking to people who have gum disease and big pockets, another thing that we had learned on a personal level, my wife and I just want to throw it out to you, is the hydroflossing, right? And whether you put something in the bucket of water or not. But what we've seen is, look, you hydrofloss, you see a lot of blood pouring out, not a good thing. But over time, you keep doing it again and again, and you do get that nice positive feedback. Wow, the blood's not there anymore. And it was a lot taught to us that this closes down pockets, actually reduces the size. Is it true? Is it all in our head? Tell me.
It's completely true, for sure. In fact, Hydrofloss is the best oral irrigator out there, has been for decades. It's incredible. It's a hydromagnetic system where it's got little magnets at the tip that polarizes the water, makes it more effective at taking off plaque and stuff. But no, it's absolutely true. And in fact, think about this. If you take a piece of floss and you go between your teeth, you can get the floss 2 millimeters down below the gum, maybe, because just the surface nature of your gum is going to stop you. You can't force the floss down in a V-shaped way, but the water can. The water can get down there. So when I have a patient that's got deep pockets and we clean them, what do I say to them? You need to get an oral irrigator. There's no way you can now flush out these clean pockets that we just made clean for you with floss. And I love floss, but it has its limitations. So the Hydrofloss is an excellent tool to have.
All right, I'm going to take a big risk now. It's all on me.
Yeah.
Personal transparency. I can see the comments already and the emails are going to be coming in.
Okay.
Jonathan, we love you, but you're a little too transparent. But I'm going to do it anyway because I think it might be interesting for people to hear. So when it comes to the flossing, what I also have noticed on some of maybe those bad days where I want to check myself,
Yep.
I take the floss, I put a little essential oil on it, and I put that on there, and I go up and down in between the teeth. But even before that, I might just stick floss in between the teeth, and I smell the floss. And if that floss is a nasty smell, right away I've got the nothing fancy about it test telling me right away, I better watch out. I better be more careful. And in 2-3 days of being a little bit more diligent, getting the essential oils, just literally putting 1 drop on my finger, go along with the floss, stick it up and in there, 2-3 days, boom, do the same kind of test. Wow, the smell is gone. I mean, it sounds kind of funny to say this out loud, but this is like real stuff to be able to tell you, am I heading down the road of more gum disease or am I keeping my mouth pretty darn good?
Right, how simple is that? And by the way, a lot of my patients do that, so you're not alone. And it's a really good test.
Is there a connection? Also, I realized I mentioned it to you before, but I want to ask you directly. Is there a connection between the white tongue and someone that has more of that kind of bacterial overgrowth, if you will, tongue-wise, and connected to gum, or is it completely separate and you don't see a connection? How do you stand on it?
Well, there's an oral and a systemic connection. So Chinese medicine, they use the tongue to diagnose everything, right? And it is true in that I can look at someone's tongue, for instance, a perfect example. If someone's got a deep crevice down the middle, they've got some gut issues. There's some gut stuff going on. And you can test that by when you fix the gut, you'll notice the crevice goes away and the tongue flattens out more. But from an oral standpoint, no question, if people aren't brushing their tongue, you need to start. Get a tongue scraper if you want. If you gag easily, those tongue scrapers are great because they're kind of horseshoe shaped and you can get back pretty far and pull stuff off the top of your tongue without gagging.
Just to be clear, that's, with little rubber handles, but it's a metal piece.
Metal or there's even plastic ones that have little ridges, almost like little teeth. And you go back and you can really feel you're scraping the tongue. You got to clean your tongue. That's where a lot of the bacteria reside. And I look in someone's mouth, and if I see a clean pink tongue, I think, wow, the rest of their mouth is probably clean as well. When I see that white layer like you're talking about, or worse, it gets so bad in some mouths, John, not to be too crude, but if you look on the very back of the tongue, you'll see little finger-like projections coming off the back of the tongue. That's not part of the anatomy of the tongue. I'm telling you, clean the tongue.
Yeah, it's pretty nasty, absolutely. And we mentioned in another conversation about mouthwashes. Obviously, I think most people at this point watching what we're talking about here, they know that the conventional mouthwash is no good, but there are herbal mouthwashes that feel really good to me. Can you speak to that?
Yeah, exactly. Don't buy any mainstream ones. They're just a waste of money. Tooth and Gum, which I think you know of. In fact, it's from here in Florida. Bernie Schechter made that years ago. It's a really good. It's all essential oils, and there's been studies again to show when they put a drop of that on a slide with bacteria, the bacteria literally run to the other side of the slide and stay that way for over an hour. It's amazing as compared to any other mouthwash on the market. OxyFresh makes a good one. There's probably Thieves Oil ones. There's probably plenty of good ones. What you want is either essential oils or ingredients that you actually know what they are, right? That's what you want, and no sugar.
With the hydroflossing, going back to that for a moment,
Yes.
because I mentioned just for a moment about putting something in the bucket of water, is there any value to that for any people out there at all?
Absolutely. Whether it's tea tree oil, neem oil, thieves, whatever you want to put in there. Those are all really good. You can put anything in there, right? It doesn't matter. Cinnamon, peppermint oil, if you can tolerate it, those are all good anti-infectives.
Just be a little careful, right? Because it could muck up the machine if you put a little too much, right?
Yeah, you don't want to do more than a couple of drops, to be honest, in that whole basin. That's plenty.
And going back to the oil pulling is another pro tip. Don't oil pull, rinse for 5-10 minutes, little, maybe half a teaspoon or a teaspoon of coconut oil, whatever you can tolerate with the liquid that it generates, the saliva, but don't spit it out in the sink, right?
Right. That's a good point. I wonder if people know that. You will clog that sink very quickly. Yeah, that needs to go into a wad of toilet paper in your trash. Do not spit in your sink.
Okay, so now how do you deal with gum disease that I guess is varying degrees, which is important for people to simply understand. But when you see that in your chair, in your office, what are some of the things you do as a dentist for those people who are visiting you?
Okay, so yeah, as I mentioned earlier, basic cleaning is important, right? I mean, actually scraping off the tartar on the teeth and smoothing the roots and all that, that works. You're getting rid of the actual obvious bacteria. Beyond that, though, if you can have ozonated water in the process, whether your hygienist is using her ultrasonics or she's hand scaling and then rinsing, it's nice to add ozonated water because you're getting that antibacterial effect and antifungal and antiviral. So you're cleaning up all the different kinds of bugs that are in there. Cleaning is, first of all, diagnosing, figuring out exactly where you are. As you mentioned, there's levels. So once you diagnose that, then the proper plan, and you don't have to be aggressive. Listen, there's a lot of too much dentistry that's happening out there, not to rattle my profession, but there's a little too much of non-surgical therapy going on. We don't need to be doing that on everybody. You need to base it on the number of pockets that are deep, and you can tell because they'll bleed very easily. You focus on those areas, right? Get the mouth clean, have a discussion with your patient about these home care remedies that we talked about. That's really all you need to do. Now, obviously, the diet's important, all those things that I've said a million times before, but just technically what we do as dentists is cleaning it up for sure.
Actually, split that hair, though, for a second, just if I can ask you really quick in terms of I don't know how many hygienists are out there, and I know it varies just like any other profession, less experienced, more experienced, which dental office you go to. Are there different kinds of teeth, cleaning of the teeth that goes on, different procedures, deeper cleanings, regular ones? Can you split that hair for us?
Yeah, I mean, I can. You have to have really good equipment, first of all. You have to have the real fine tip scalers that have the nice mist of water that comes on when you hit the sonic button. I mean, it's really important, right? You don't want, because if you're using hand scalers and they're dull and all that, you're actually going to hurt things. You're going to tear the gums. A simple answer to that is if you as a patient, if you go to your hygienist and you leave bleeding, that's not right. It's just not. Even if you're dirty and you come in there and you're disgusting, if they clean properly, right, and do it well, you shouldn't walk out of that office bleeding. That's the first.
Interesting.
Yeah.
I spoke to a biological dentist who, it was a thing with her to really warn people who have heart disease,
Yeah,
right?
yeah.
Who have autoimmune disorders. It was actually a big thing with her that she was saying, watch out. I suppose she also meant kind of what you were saying about being careful what dental office you go to, because you're surprising me right now. I didn't know that to the extent of even somebody who has bad gum disease. Is there a concern that someone who's in a depleted state, immune compromised, they've got serious health problems, they go into a dental office, they get this cleaning, they're bleeding all over, and then that's spilling into their body. That's a concern, isn't it?
For sure, and God forbid that office isn't doing the right sterilization procedures. I mean, you need to really, listen, patients should be able to ask the dentist, can you show, before I even come on, can you show me your whole sterilization process? Walk me through it. Can I come in the lab and see it? Because if they're not doing hand cleaning, soaking in a solution like glutaraldehyde or something like that, cleaning it off again, and then going into a heat sterilizer for a certain amount of time, you're not sterilizing things. And by the way, you can have dirt and stuff on a scaler, not clean it, okay, meaning it's still on the scaler, put it through the heat sterilizer, and you still have live bacteria hiding under that thing that's on that scaler, even though it's been through heat sterilization. You have to do every step. So ask your dentist, show me and if they don't want to show you, you need to leave. Right? We should all be, this is standard of care. Okay? Things like COVID and like this don't scare dentists at all because we're dealing with things like hepatitis B. So we treat everything like it's a bad infective, right? So that's standard of care. So yes, so just to get back to your question very precisely. First of all, got to be sterilized, clean instruments, got to be sharp and fine-tuned. Skills of the hygienist. If you go for a cleaning, and this is across the board, just a general rule, if you go into an office and your cleaning is less than an hour, it's not thorough. It just isn't. I don't care if you have 28 teeth or 32 teeth. They need a full hour to not only probe and check how you're doing, maybe ask you a couple of questions, but to thoroughly clean every tooth, rinse, dry, floss, all that stuff. They need an hour. So if you're getting a 40-minute cleaning or a 30-minute cleaning, so what happens, Jonathan, is they leave stuff, right? They're just cleaning kind of what you're going to feel. Above the gum, right? Feels good to my tongue. But the problem is not above the gum necessarily. It's below the gum, right? Even if it's just slightly below. That's where biologic dentistry comes in. We're going to spend more time cleaning things.
And just the last word on ozone therapy for someone with gum disease. Is there any connection between the two?
It's fabulous. I mean, I use it every day. I can't say enough about ozone. Besides the obvious stuff that I mentioned, ozonated water while you're doing the cleanings, ozone gas may be squirted under the gum and in those deep pockets. There's a treatment that we do called tray therapy. It's kind of neat, where we make these little silicone trays that are fitted to your mouth. There's an in port and an out port. And for patients that have really bad gum disease, and I mean, this is amazing. You can change things overnight sometimes. You sit them in the chair, you put the tray on the bottom teeth, turn on the ozone goes into one port, it innervates everything, the gum, the teeth, the whole area, right, because it's sucking down around the whole area. And then the out port goes to a suction that's on very low, so the ozone stays for quite a while, 20 minutes. Do that, then then you do the upper tray, do the same thing, 20 minutes. And I mean, it's unreal what it does. It's just amazing. So ozone's, it's the closest thing to a panacea that we have in medicine.
Dr. Cole, great information. Just in case anybody was sleeping, which I'm only kidding, I'm sure they were paying attention. But in all seriousness, the worst gum disease out there, bleeding gums, they really feel bad about themselves. I just want people to get that final message from you. This is all reversible. Listen to this 2-3 times. Take the notes. Don't get overwhelmed. Start with just 1 or 2 things of what we talked about can really start turning the ship around. Is that fair to say?
Fair to say, for sure. All forms are reversible. Obviously, the extremely advanced ones, you can at least get some stability. You're not going to grow your gum back. You're not going to grow your bone back at age 50. But you can get some form of stability and health to where even if I'm probing a deep pocket, there's no bleeding. So the take-home message is this. Whether you have it, a mild case, or you're getting advanced, get yourself, first of all, get the stuff clean. Get to a biologic dentist, get it diagnosed properly and get it clean. Then do these things that we talked about at home, simple things you can do, and you can reverse this. And by the way, as I mentioned earlier, you can start to have if God forbid there's some plaque that's forming in your arteries, will start to go away as well once you get this clean.
I have one gum personally that's really receded, and I love what you said. You may not get all perfectly right back, but it's the same, and every year I go, ooh, wow, look at that one. Oh, we know you already at this point, but it's stable. And that's the key, that we can, even though we're not perfect, we can live our whole life relatively pain-free and have a really good quality of life.
Agreed. Well said.
Thank you, Dr. Cole.
You're welcome.
I hope you enjoyed day 1 of the Cardiovascular Docu-Class. We've got so much more to offer you, so get ready. Day 2 is coming up. Talk to you soon. Take care.